Do you know, I've been a hip surgeon for nearly 25 years. I can't really believe it, to be honest. It's flown by. I've done thousands of hip replacements, resurfacings and revision surgery over the years, and I must have seen tens of thousands of patients. When you meet so many people and ask them about their problems and their health, you see patterns emerging. First impressions are very important, but doctors are trained to look beyond these. Subtle physical and psychological symptoms and signs make your sixth sense tingle, and you probe a bit deeper to find out what lies beneath. This sort of detail, of course, is really important because it affects the outcome of surgery, and I need to do everything that I can to make sure that you get the best result. Let me share with you some of the things I've seen. I'll tell you how you can improve your prospects of having successful hip surgery. Keep watching. Let's look at some of the things you can do to help yourself reduce the risks of a bad outcome. People who aren't overweight seem to do very well, but if you're on the heavy side, this increases the risk of wound healing problems and infection. Smokers worry me because they're much more likely to have a stroke or a heart attack after surgery. Smoking also increases the risk of infection, so stop it now. If you're fond of the bottle, that's a worry too. The painkillers aren't as effective, you bleed more, and you're more likely to do risky things after surgery that increase the risk of falling or having a dislocation. Poor dental hygiene increases the risk of infection, so have a dental checkup well before your hip surgery. I won't operate on you if you have an active dental infection or loose rotten teeth because the risk is too high. If you're on medication for high blood pressure, diabetes or other chronic diseases, it's worth checking with your GP to make sure that everything is as good as it can be before you decide to have surgery. If you've been very immobile for several months, then you'll probably have weak muscles and bones, osteoporosis. You'll probably have problems with your balance as well. If you can, have a few sessions of physiotherapy before surgery. I can help you with that. This will definitely help, but I know it isn't always possible. Sometimes we've just got to get on with it. It's all about me, really. I hate complications, so I do everything humanly possible to avoid them. How do I do this? Well, first of all, I make sure that I know everything that I can about you so that I can plan the best operation for you. I talk to my anaesthetists and let them know if I'm concerned about you. They'll get in touch with you and give advice on what needs to be done. Every time I pick up a scalpel, I want to do the best operation I've ever done. When I see you in clinic for the first time, I'll go through everything with a fine-tooth comb. I quite often pick up problems that haven't been diagnosed before, such as atrial fibrillation, gout, or inflammatory arthritis. I will help you to get everything sorted out before your surgery. It might delay things for a while, but all that matters is that you have the best chance possible of getting through surgery without a hiccup. And of course, I get to sleep soundly at night. Everybody's happy. Thank you for watching. If you've got any questions or comments, please leave them below. If you want to get in touch with me, the details are in the description. See you all again soon.